Okay, so I'll bring Lauren back up for the address of the incoming president.
Thank you. I am looking forward to serving the NJAFP as president this year. Family medicine continues to be a rewarding and challenging profession for us. We are fortunate to have an active academy dedicated to patient advocacy and improving the medical environment for New Jersey family physicians. You have my report, so I'd like to just take a couple moments to highlight some things. A lot of this we've already kind of talked about, so that's convenient. The opioid epidemic or crisis is really important. You hear a lot from legislatures, you hear a lot of media, you don't hear a lot from us. So I think it's very important that, that we stay on top of what's going on, that our voices are part of the solution, and we follow the AAFP's recommendations, which they made at the Family Medicine Advocacy Summit They recommended to Congress to increase access to substance abuse treatment, to look into alternative treatments for pain, and improve healthcare coordination. So these are things that we should be doing at the state level also. We already talked about the bylaws that we've updated this today. Moving forward, I'd like to take time to actually look into the bylaws and consider changing the House of Delegates and its governance. At the AAFP Leadership Conference, a lot of time was spent on looking at how we are doing things as a whole and making recommendations to bring us into the future. The goals with this endeavor will be to modernize our House of Delegates and review the board roles to ensure an increased member involvement at this annual meeting and throughout the year, and ensure adequate representation of our members. This is a big undertaking, and I would like everyone's involvement and input and welcome their input as we make these changes to make meaningful, valuable changes to our academy. Again, primary care spend. I think it's something that we really should be focused on this year. Other states that we heard about earlier have successfully implemented an increased primary care spend. At the local level, Horizon has said they are committed in media to increasing primary care spend and access. This is a great opportunity for us to first define what primary care is in this state and then work on increasing primary care spend, whether that's legislative or in other ways. So it's something I think we should look into this year. And finally, we all know what family medicine is and what we do. And I feel that other professions are able to really put out there in the media, legislature, or just in general how great they are. And we've really kind of lagged behind the PR. And I think moving forward, we need to make a better effort at forwarding ourselves and letting everybody else know what we know about how great family medicine is. I'd like to see a PR campaign this year focused on New Jersey family medicine doctors, maybe submitting anecdotes and stories and editorials, or just getting our faces out there more. I'm honored to have the opportunity this year to represent you and look forward to working with you in the Academy. Thank you.
Thank you, Lauren. Okay. We did that. Ray has told me that his report is in the book. He doesn't really have anything to say in addition to that unless someone has any questions of him. So any questions for the report of the Executive Vice President? Okay, so the next on the agenda is the election of the nominating committee. For those of you who don't know, we rotate counties. Basically, we pick someone who's not here because they can't say no. So the counties that are up this year are Hudson County. Who's here from Hudson County? Sally. So is it you? To serve on the nominating committee? Okay, good. Some people are born with greatness, others are thrust into it. Nice job. Okay, so that's Hudson. Now, Hunterdon County, who's here from Hunterdon County? There we go. Terry? Very good. I want to get that on tape. I just want to make sure that, okay. And Middlesex County, finally. Who's here from Middlesex? Middlesex, anybody here from Middlesex? There is no one at the, all the way in the back. Okay. Oh, Karen Lynn. Okay, so you're going to be on the nominating committee? You choose to serve? Very good. I like that. Ray, you got that down now?
I do.
Okay, so You know, you have a meeting like once a year. Sometimes it's a phone meeting, but, you know, it's got to do with the candidates, obviously, for the following years. And, of course, as part of that, you're also responsible for recruiting new members to the board. Okay, so we're going to move on to resolutions now. And I'm going to call the first two initial resolutions were presented by Dr. Peter Carrazzone, so I will ask him to stand. We'll put them up on the screen if they're not already. And we can have debate, questions, concerns, comments, and then we can vote on them. Peter? The resolves only, Peter, as you know.
Well, I'll just give you a little bit of an overview first. This has to do with our coding. Medicare forgets on a yearly basis, and I thought that was an issue that we should try to correct. You just want the whereases?
No, the resolves, actually.
Just resolve. Resolve that the New Jersey Academy of Family Practice present a resolution to the 2018 AAFP Congress of Delegates requesting that the American Academy of Family Physicians petition CMS redesign documentation requirements that take into account the relative risk in order to ensure the family physicians are truly being paid on the severity of patient illness rather than a physician's ability to document.
Thank you. I assume everyone knows what the issue is here, Peter. Maybe a little bit more background.
Well, when you're doing your coding on an annual wellness visit, you have to put as many codes as possible to give an idea of the severity of illness that we get reimbursed in a value-based model. So the more, you have to remember to put all the codes that add to that severity. Some patients, it could be 15 different diagnoses that you have to put down. It's a bit of a burden. It adds to our burnout. And then every year, Medicare forgets it. The slate gets wiped clean, and then you have to redocument all these things, even though the amputation doesn't go away, even though the diabetes doesn't go away, or many of these chronic illnesses don't go away. So it seems like a bit of a game rather than Medicare trying to help us and diminish documentation and help us with our EMRs and our burnout. They've added to it.
Okay. Any questions, concerns, challenges, thoughts? Go ahead, Mary. Step up to the microphone.
Yeah, so I think this is an interesting thing to bring to the AAFP. I don't know for sure that they don't have some position on this already. So that was one thing I was going to ask is did we look into that? But otherwise, I think it is important, and I know examples in our own group where part of why our health system decided not to have an ACO anymore is because the government disagreed with our risk assessment of our patients, and then we weren't getting the money we thought we were going to get for shared savings. So it is a very important piece of being able to get paid in the new environment. So I would support this. The only thing, I think there's maybe an editorial there. There's two these, so that I think you want to take into account the historical relative risk.
Yeah, get rid of the second D.
No, the second thing, right there, yeah. And then the only other question I had for Peter is, there are certain problems that do resolve, and how do we address that portion of this as far as implementing it someday?
Peter?
Well, they could technically find or divide this, and a URI is something that would go away, but an amputation wouldn't go away. So they would have to divide the codes into codes that will never disappear in a patient's diagnosis to acute care type codes. I didn't address it in there. I didn't think it was necessary, but yeah.
Right. Arnie, are you rising to? Yes, sir.
Yeah, so I do rise, Arnie Palla, to support this. I'd be curious if, John, you have a comment about this from National, if there's anything much on the horizon, if you don't mind enlightening us. Sorry.
I think it's a good resolution. I don't think we have anything in current policy that addresses this in particular. It definitely follows along with our underlying strategic plan of reducing administrative burden, and there's certainly within CMS there's some responsiveness at this point in time for things of this sort. It's interesting in Canada, because I was just up in Canada recently. They really have two designations. They have complicated patients and uncomplicated patients, and the complicated patients, I don't believe they have to reattest to that every single year. So I think this is a good resolution.
Great. Any other comments, questions, concerns? Okay, so all those in favor of the resolution after taking out the second "the," raise your hand. All those against? Any abstentions? And the ayes have it. Resolution number 1 is passed. Dr. Carrazzone, resolution number 2.
This resolution has to do with annual wellness exclusivity. Actually, when I was at Penn State, I got a text, I think, from Tom McCarrick telling me, look at what Lifeline is doing. They're doing annual wellness physicals on our patients. They shouldn't be doing that. They have no plan. They're not going to take care of the problems. They're just trying to reap it on the bucks. And that's where the thought of this resolution came from. So be it resolved that the New Jersey Academy of Family Practice present a resolution to the 2018 AFP Congress of Delegates requesting that the AFP petition CMS to limit Medicare annual wellness exams to primary care physicians, such as family physicians and general internists, that devote their specialty to primary care and have the resources and the training to address the issues found on an annual wellness exam.
Okay, I'll ask Dr. Cullen to come up again and maybe give some insight into what else is going on in national and where the other states stand also.
So I believe that there was a resolution that was passed within the last 2 years that was similar to this, in that, except that the wellness exam was supposed to occur within the context of a medical home. But I think that that was the main difference. That is that there was some debate that whether or not to have, that it would be okay for nurse practitioners to do a wellness exam, but only in the context of their longstanding medical home. I don't know how well this would fly in comparison with that one. That would be my only concern.
But that one didn't fly either, is that correct? But CMS is obviously paying other entities to do wellness exams and paying for them, so I guess that resolution, it may have passed, but I mean, it didn't go anywhere at CMS, is that right?
It, unfortunately, they don't just take everything we say. It just
That'd be nice. We could live in a perfect world sometime.
Yeah, we're working on that.
Okay, all right. Oh, no, I just to clarify. I mean, obviously, that's right. Dr. Campagnolo.
Yeah, so I support this. I think it's another good idea of Peter's here to put this out here. I think, though, in accordance with the previous resolution we had at AFP, that if we're going to bring this back, and it may just come in as reaffirmation of policy, but I still think we should bring it as limited, where it says such as family physicians and general internists. We probably should add and their practice teams, yeah.
So you want to amend the resolved.
Right, because actually when you do annual wellness visits, there's a lot of it you could also have with medical assistants even doing a lot of the questions. Mm-hmm. And so, again, the physician may not have to do much except the latter parts of it and attest that the other answers were correct. So,
okay. So that's the amendment that you propose. So we're going to have discussion on the amendment, and then we vote on the amendment, and if the amendment passes, we vote on the entire resolved. I'm sorry? Okay. I apologize. Dr. Cascarino, voting on the amendment to the resolution? Or speaking on the amendment? Oh, you have another topic. Okay. Does anybody want to speak on the amendment to the resolution?
Just that I'm in favor of it.
Very nice.
Me also.
Okay.
Just a question. Is the practice team, does that imply nurse practitioners and physician assistants as well? Or should we explicitly put that in?
I'm not doing the amendments. The House is doing the amendments. It's the will of the House as to what they want to do. So if you want to further define what practice teams means.
Dr. Schauer,
Yes, sir.
if I may, we'll go through a process once this, assuming this passes, we'll then go through a process with the delegates to craft a resolution. So a lot of that will probably come out in the wash.
That's fine.
Yeah.
Works for me. Okay, so we're voting on the amendment to the resolution. All those in favor of the amendment to the resolution signify by raising your hand. All opposed? Opposed? Okay. Abstain. Okay, so now we are speaking about the resolution as a whole. Any comments, questions, concerns on the resolution as it now stands amended? Dr. Gorman.
I just have one more friendly amendment, and that is just to use the words, the terminology that CMS uses, which is not annual wellness exam, but annual wellness visit, because, you know, as you know, you don't even actually have to do an exam to satisfy an AWV. Mm-hmm. So I thought we should probably just take the word exam out where it exists and use visit in its place.
If it's okay with Dr. Carrazzone, we could accept that as a friendly amendment. That's the thumbs up, yes. Okay, so now we're voting on the resolves as amended and a friendly amendment attached.
On the first line is exam as well, that would have to be edited.
Okay, good editorial. Okay. Okay, all those in favor signify by raising your hand. All those opposed? Any abstentions? Great. Resolution number 2 passes. Now we have an emergency resolution coming up that I believe Dr. Ortiz has given in a timely manner so that we may take a look at it and discuss. Dr. Ortiz, you're up. Now before you say anything, Tom, I just wanted to recognize in the House that Dr. Ortiz has been nominated and chosen as the NJAFP Family Physician of the Year this year. So I think he deserves some recognition at the House level.
Very appreciative of the support of my academy. This resolution comes out of some of the discussions we had this morning about mandating certain amounts of money being spent on primary care in at least the Medicaid programs around the country. And I thought that, and I know that we've been working on, according to Claudine, we've been working on it behind the scenes, so to speak, with the legislators. But I wanted to make it a resolution so that we have it in front of the board as we move forward this year. Hopefully, we can have a legislative situation where it's being mandated. So the resolve says the NJAFP continues its advocacy efforts as a high priority to promote and establish a minimum primary care spend percentage to policymakers in Trenton for New Jersey Medicaid, state health benefit plans, and the state-regulated commercial insurers. Pretty simple and sweet.
Mm-hmm. Any comments, suggestions, questions? Yeah, sure. Okay, good. All right. All those in favor signify by raising your hand. All those opposed? Abstain? Okay, resolution number 3 passes. We have no more emergency resolutions. Is that right, Ray? Very nice. Okay. All right. Okay, so we're going to do committee reports. I'm going to start actually with the Government Affairs Committee, since a lot of what we've been talking about today, you know, has certainly been related with government affairs and policy and, you know, Trenton and Washington and here, et cetera. So let's bring up Claudine Leone. And Peter, you're still running that show, right? She's going to do it. Okay, that works for me. Claudine, enlighten us.
Okay. Well, thank you. This is Government Affairs report, but I did want to just make sure everyone looks at the Communications Committee report when you get there, because I know we're going to skip. A lot of the communications through our public relations firm has been government relation oriented. So Dr. Ciminelli and Dr. Carrazzone and everyone else who I reach out to has gotten a lot of calls from 101.5. We've been kind of getting out there a little bit more as a go-to organization. Dr. Carruth's going to be a great spokesperson. She's going to answer the call and become friends. Who's your guy at 101.5 now? Who's your favorite? Whoever the reporter is? Yeah. So we have PR-wise, I think when they need primary care, and they're coming to us. So that's really, really good. So, okay, go back to your government affairs. So like you said, we've been talking about a lot. The majority of the year really has been a lot of my time has been on the non-legislative front on the website development and working with Dr. Ciminelli and Peter and Dr. Carrazzone on the task force. It all is to support advocacy, so it wasn't like I wasn't working on advocacy, but it really gives a good foundation and a location to send a lot of the staff people in Trenton to. So if you just look through, mostly the website kind of sets all the problems out and some of the fixes. And while this started out as workforce, it really is some of the problems that are going to solve for not just the new physicians. Loan redemption law in New Jersey is going to get fixed. There's a bill pending that we're supporting, and we are fixing it. However, I don't trust that the state can still do a good job at it. So Dr. Carrazzone and NJAFP and Ray and I are, working on some kind of private opportunities that we might be able to have our own loan redemption program and administer it through the association. So that's something hopefully we can announce shortly. The primary care spend legislation, can't say enough about it. I think Dr. Carruth has a great idea. We'll go and define our, primary care the way we want to. And I think what the Commissioner of Human Services said today, and maybe what you guys didn't pick up on that I did, her role on the State Health Benefits Task Force is actually quite key, because while she just deals with Medicaid in her commissioner role, the State Health Benefits Plan and the Teachers Benefits Plan are going to be the only thing the state can direct the primary care spend dollars on in their purview. So if she buys into it, we've got an advocate in the administration, and that's really what we always need. It's not just enough for me to do it. We need someone to kind of grab and run with it. And then if you scroll down, so right now we're in budget time, and one of the things I found out with the loan redemption program was that when it runs out of money and they have applicants still available and interested to do loan redemption, there are other dollars earmarked to the program that are not coming into the program. So we got language in the current budget that says we want the money back and we need it now because we have 10 people that we could give money to. So that was kind of a really good thing to get in the budget, and it's not going to leave. So it's going to be fully funded to the point instead of having our money stolen away by other programs. Marijuana. Well, he's not going to get his legalization and his tax money right now. So I think they're just expanding medical marijuana to the point where if you have a stub toe, you probably can get medical marijuana. Enough said on that. Scope of practice, I expect the fall and next year to be complete push for independent practice. I know the nurses are meeting a lot with legislators and committee members and are really going for the big push. But I really do think that a lot of the outside New Jersey executives in the administration, like Commissioner Johnson and the Commissioner of Health, I think they will educate the administration on a position that might be favorable to NJAFP with expansion of independence. I think they're going to be friendly on the issue. And opioids. It never stops. NJ Cares is Murphy's one-stop shop for everything opioid, from regulations to professionals and otherwise. And Sharon Joyce, who is Dr. Tabachnik's wife, she's been tagged with heading that task force. So she and I talk often. She's trying to meet with Dr. Feistel and several other of our members and other specialties. So she's very engaged with us. So as far as opioid, Dr. Ruth, I'll introduce you to Sharon and get you moving along with her. And while this is not a professional society, this is a society issue, not necessarily individual, but when they pass these regulations trying to control how much money you guys are getting as speaker fees, because I know you guys get millions of dollars in speaker fees on a regular basis, right? You're all doing that, right? This regulation had a negative impact on NJAFP because the way it was defining CME. So, they were putting this $15 meal cap, and Ray and Teresa would call me saying, pharmaceutical companies are telling us they can't, they can't fund a grant because it's going to go to food, and we're not supposed to feed New Jersey physicians anymore. So, and it was carrying beyond New Jersey. I mean, if you went to something in D.C., they would embarrass doctors and say, who's from New Jersey? You have to raise your hand, like, you can't eat. And it was ridiculous. So we finally got a proposed proposed reg in the works that's going to take any negative impact on NJFP and its CME activities. The $15 cap is not going to be included, and you shouldn't be asked to raise your hand at any point you leave the state. Wow. How about that? That was my conclusion.
I think an exhibitor just heard about attendance and passed.
So if you have any questions, go for it. You need a microphone.
Microphone, please, Dr. Ortiz.
Clarification on the medical marijuana, the new regs with regards to how doctors can or need to get registered or don't get registered, or who can now recommend medical marijuana?
I don't know the answer to that other than they've expanded it and they've made it easier. And I know Department of Health has a link that doesn't say much. Okay, I'll look into it.
Dr. Narullo?
Okay, good.
I don't know if it's changed since the last time that we were doing authorization for medical marijuana, but it's still, you only need to complete a 2-hour online course for opiate and addiction, and then apply on the nj.gov site, and that's really it. And then they send you back a approval or a denial.
Thank you.
Okay.
Yeah.
All right. Thank you.
Any other questions for Claudine? No?
And thank you to Dr. Carrazzone for, it was a great year, and Dr. Ciminelli and Aditi, everybody has been, so supportive of the workforce in getting answers and responses in a timely way. It's been really good. Good year. Thanks.
Perfect. Moving on with committee reports. What happened? Oh, I'm sorry. Dr. Palais.
Claudia, if you could just tell the group your sense of Governor Murphy's approach on health care. Will he sign these bills or not? The nurse bill, these other bills, because he's pretty aggressive with the marijuana issues, et cetera, et cetera. What is your take on what he is saying this early in his tenure? Thanks.
All right. Yeah. I think kind of what I said before, he's surrounding himself with good healthcare minds in terms of the Commissioner of Health and Human Services coming from outside New Jersey. I think bringing fresh ideas and maybe not just doing political appointments of some New Jersey friends. We're going to see a little bit of difference in that area. He has a good healthcare policy person in his front office. But it's been a bumpy road. I mean, it's been a bumpy road in general. So, when you have a governor or you have a governor, it's kind of like when we had Governor Corzine. When they're not coming from politics, they have to learn how to operate in Trenton and deal with the legislature and personalities. So I think that there might be struggles in that area, but in terms of maybe they're getting some stuff done, like, Commissioner Johnson is just going to kind of plow along with her stuff, and he's giving them free rein. So I don't know if I'm answering your question. I don't know where he is on the APN issue. They did endorse him because that's what they do. So we have that up against, as a challenge. He did not make the majority of the medical community happy by signing the out-of-network legislation. That was probably the big disappointment for your colleagues and emergency and other emergency specialists. So I don't think he is viewed, favorably on that legislation in his decisions. Do you mean just by meetings or by appointments or like official roles? Yeah, so I mean, we're meeting.
Just repeat the question for our TV
So
audience.
Dr. Schaffer is asking if we can be more, get kind of real live people, I guess, in front of them a little bit more often. So we do. I mean, we've been, we have, I think maybe at the last board meeting there was a list of all the meetings that we had scheduled, and actually the Commissioner of Health meeting is coming up on the 25th. We're going to have follow-up meetings with this commissioner. Ray and Sandy and I met with the governor's office on his healthcare policy team. I mean, we're doing it. So we lay the groundwork, and if they need a specialist to come in and explain something in more practical details, that's when, we bring you guys in. So, yeah.
Mary, microphone, please.
One more quick question. I think Lauren addressed a little of this in her talk. A number of the pharmacies are putting certain new policies in place, which I think directly impact our practices and hinder our ability to care for people in a timely fashion. Is there any legislative initiative that you see in that that's going to be practical to help control that, or other things we can do with our pharmacy partners?
Is this on like them expanding their scopes, or is this on the barriers to? Yeah.
Expanding scopes on vaccines, from what I hear, came up last week, and also barriers to prescribing of any opioids that might turn up even under the regulation.
Yeah. So we've been dealing with that ad hoc as we hear. So if I hear a certain pharmacy is doing that multiple times and it's becoming a policy, we've been raising it with AFP if it's a national trend. So it's on my radar, but I have to hear about it, so I have to know, and I think that's the challenge of knowing exactly what you're coming up against. On the, was it the other one? Was it vaccines? The vaccine bill was, I think I'm trying to remember, it had to do with ages, and it had to do with pharmacy technicians or pharmacy assistants. And I'll look at that with more detail. But the pediatricians had negotiated an age agreement with the sponsor, and they didn't really involve us, but it had to do with like over 13 or under 13. But I'll look at that and figure that out. But yeah, they're trying to expand, just like, Costco.
Thank you, Claudine. Okay, moving right along on committee reports, I'm going to ask Dr. Ciminelli to come in and give the annual meeting committee report.
Short here. So welcome back to Atlantic City. My report really is in the book, so I'm just going to highlight a couple of things. First off, last year when I took on the endeavor of being the chair for the annual meeting, I never thought it was going to be this much detail and this much work, and really the people to thank for that are our talented and energetic staff, especially Teresa, who really heads everything up. So really, when you see them, please thank them. It is a lot of work and organization, and they do a great job at that. Also, they did a great and fantastic job at getting us a lot of exhibitors this year, so our funding is a little bit better off than some other years. They've really worked hard at that, so please stop by the exhibitor booths and support them, get some information from them, and make the most of this meeting as much as you can. I also implore you to, maybe if we spread the word more and more, we'll get more people to attend every year. Let's get more energy and more young and fresh blood into the academy, and hopefully find some good leaders in there as well. In terms of the program, yesterday we had a great pre-conference with value-based care symposium. We talked about HCCs. We also talked about generational changes and the approaches in terms of transforming your office practice to engage with these different methods of change that are necessary for getting the new generation to stay in your practices. Other things, we have some innovative, different conference-style things this year. We have some interactive-based programs with how to communicate with patients who have misused or abused substances, and also in terms of communicating with people with depression. We do have also a very interactive session scheduled for Sunday morning, hosted by the EMS people at University Hospital and head of trauma there. Unfortunately, with all of our gun shootings and tragedies over the course of the year, I think that it is important for us being first line and being able to stay calm and be able to deal with such crisis intervention, especially with bleeding. So that's one of the major interactive highlights for Sunday morning, as well as interactive based discussion of in-flight emergencies. I think we've all been there on a flight somewhere and being asked, is there a doctor on board? So think about attending those kinds of sessions as well. We also have a joint injection workshop. And if you'd like to stay after and get some extra CME, there's another KSA. Again, very appropriate in terms of topic based on pain management. So that being said, I think we have a good program ahead, and please come to the gala and celebrate Dr. Carruth in her installment as new president, and I look forward to working with you. And thanks. Have a great assembly.
Thank you, Maria, for all your hard work. You and the committee's hard work, and the staff, of course. Okay, moving on with committee reports. Sorry. Okay, we're going to move on to the report of the resident trustees. Dr. Narula? I think it's always good if the residents and students come up to the podium so everyone can get a good look at them while they're speaking. And now, you're a third year now, Dr. Narula? Are you going to impart the wisdom on us along with Dr. Resnikoff about what your plans are moving forward? Pending plans. Pending plans.
Taking a little time, doing a little per diem work, and then inpatient work, hopefully, maybe academics. So, I guess it's up there now. Excuse me? Oh, wonderful. So really, we noted 4 things that we've been working on this year. Typically, the new resident trustee selection is done before the Knowledge Bowl during the resident caucus. I believe Steve was here as well. Initiated that process a few years ago. We now have migrated onto an online voting system. We called for applications over the last month. Unfortunately, outreach and responsiveness from our residents in New Jersey has always been a problem, as it was prior. We only had one applicant who was confirmed in the block that we just confirmed earlier. His name's Dr. Thomas Wall. He's also from Center State. Secondly, for our resident caucus, since we're no longer performing the voting at the resident caucus, we're migrating the type of event that it is. We're moving towards a discussion of resident topics, such as educational things and certifications we can apply for right now that might be beneficial as we become attendings, and then discussing also just things that are going on at the national level, as well as what we're doing at NJAFP as an organization to try to keep people coming back and participating as we go forward. I just wanted to touch upon another thing that we did, which was early on in my role as a senior resident trustee. This year we managed to get to the AFP conference quite early, so we were involved in a lot of the parliamentary procedure. So we saw what resolution writing looked like, what reference committees look like, and then eventually what the voting looks like on the back end there. So that was a really good experience, because going forward as attendings and then getting involved at a state level and the national level, those are skills that we would obviously need to have, and the whereas and resolve makes a lot more sense. The last thing that we've been working on with the Student Debt Task Force, you can see the website, or you saw the website earlier, that we've been working on throughout the years, the last 2 years. We're waiting currently to have some meetings with the legislature, but we've put together a lot of information about why this is a really big problem in New Jersey, and why the student debt problem is a good way to resolve a lot of those dominoes that come with it. Keeping physicians here and in primary care leads to a lot of benefits for us down the line. It saves us money, it increases the time spent with patients, and all those kinds of things. It has a lot of good ramifications, but we need more numbers is the point. That's really it, unless there are any questions. Yes, so this is the voting website. There's room for approximately 4 applicants per right now is Dr. Wall. He's taking his Step 3 exam this weekend, or he would be joining us. All of his credentials, along with the CV and stuff, along with a statement of interest, are all available online as well. So that's for your review if you'd like to. All right, thanks.
Thank you, Navi. Wait a minute, Dr. Resnikoff. Whoop, Dr. Resnikoff. So, as the junior resident, as Dr. Narula graduates and goes on to a better place, what would you say, without putting you on the spot, your focus would be moving forward for this year, given the challenges that were already undertaken by Dr. Narula and yourself, of course?
Well, hello, everyone. I think as the new senior trustee, it's important to try to get the word out. As Dr. Ciminelli said in her report, we have to get some new blood in, and this year we did some changes, and we'll see how that plays out in the future, but we do plan on targeting medical schools to entice student participation and hopefully getting the word out earlier about family medicine as a career choice. And now that we have some legitimate things set in place for student loan redemption, then we can hopefully use that to try to bring them into the profession. Also, resident outreach too. So I do plan on sending emails and contacting the coordinators on a regular basis so that we make sure we have accurate contact information for all the residents so that we can hopefully make some summit or election advances earlier than we did even this year. So, any questions? Okay, thank you.
Fantastic, thank you. Thank you very much. Oh, she's unflappable, huh? Very nice. Okay. Are there any student trustees here? I don't think there was a report submitted, was there, Ray? No? Okay. All right. Hopefully next year. New physicians. Where's our new physician? She's the new? She's coming in? Oh, that's okay.
Hello, everyone. My name is Mariana Salniker. I'm coming in as a new physician. I remember coming here as a resident for the past several years, and very interested in getting involved in the academy. A few of my interests is physician burnout. As a new physician, I'm currently practicing with Robert Wood in an outpatient setting in Hamilton, New Jersey. And physician burnout, I think, touches all of us because we all experience it on a daily basis. The cumbersome of, charting and billing and seeing patients, and unfortunately the way medicine is right now, if you're working for hospital-based medicines, RVUs, and all of that combined adds to burnout. So that's an interest of mine. The other interest of mine is keeping the private practices, physician-owned private practices alive in New Jersey, because I think that brings, in terms of patient care, an avenue much more, patients enjoy having the old-time family physician practice or doc in the neighborhood and not having to go to the hospitals or the hospital practices. And I think that's becoming, unfortunately, an extinct animal. And I think we need more private practices owned by physicians. I think they'll provide better care for patients and definitely help keep costs of healthcare down. So those are just some of my interests. So I look forward to serving and hopefully making a difference. Thank you.
Thank you very much. Okay, so new physicians. Any old business to bring before the House? Is there any new business to bring before the House? Okay, the new business, if you don't know and you're on the board, we have a board meeting immediately following this. Where is that, Ray?
We need to turn this room around, so unfortunately we can't stay here. We're going to go upstairs to the Mars and Neptune room, so out past registration, up the flight of steps, past Cafe Roma. If you know where the show office is, it's along that. It's in that area.
Okay, perfect. Okay, I will entertain a motion to adjourn. Second, thank you. We are adjourned. I want to thank everybody in the House for being here and attending and giving us insight and good quality discussion on our resolutions and the subjects we brought up. Thank you very much.